तो गाइस वेलकम बैक टू myopia. ओके, myopia मीन शॉर्ट साइटेडनेस. मतलब पास का दिखता है पर दूर का नहीं दिखता. myopia, majority of the people having myopia, that's why they use concave lens. Okay, so you can see their spectacles, it will be concave. Okay, definition of myopia: it is a type of refractive error in which parallel rays of light coming from the infinity are focused in front of the retina with accommodation being at rest. Okay, parallel rays of light are focused in front of the retina and accommodation being at rest. What is the etiology of myopia? It can be axial, curvature, positional, index, or myopia due to excessive accommodation. Okay, now first coming to axial myopia. Axial myopia means as the light rays are focused in front of the retina, you might think, you can assume like the size of the eyeball has increased. Okay, for to remember in exam. Next, conventional myopia, it is which is seen in keratoconus, that is due to increase in the curvature of the lens. Okay, or the cornea, or both. With 1 mm increase, there is -6 dioptry of myopia. Okay, positional myopia, that is seen in Weil-Menckersoni syndrome, that is a displacement of lens anteriorly. Okay, the lens is displaced anteriorly, but in hypermetropia the lens is displaced posteriorly. Index myopia, the refractive index of the crystalline lens is increased, that's why the image is focused in front of the retina, that is seen in nuclear sclerosis. And myopia due to excessive accommodation, that is spasm due to accommodatory muscles. Okay, axial myopia, size of the eyeball increase. Conventional myopia, increased curvature, position, anterior displacement of the lens. Index myopia, increased refractive index of the lens. Next up, myopia due to excess accommodation because of spasm of the accommodatory muscles. Grading of myopia. Grading of myopia, you can see here, it can be low grade, that is -3 diopter. Moderate myopia, that is error is -3 to -6, and high degree of myopia if greater than or equal to -6 diopter. Less than or equal to -3, -3 to -6, greater than -6. Okay, this is myopia. What are the clinical varieties of myopia? Myopia, there are 4 types. Okay, congenital, simple or developmental or school going myopia. Next is pathological, degenerative or progressive myopia. Other is secondary myopia. Okay, in exam, if 10 marks question comes like what is myopia and explain its types, pathogenesis, signs, symptoms. Okay, then you should explain all the 4. Okay, otherwise it comes like explain pathological myopia, then you should explain only pathological one. Okay, majority of the time they will ask the pathological or degenerative myopia. Okay, so try to explain that. So but we will read all 4 of them here. Okay, first coming to congenital myopia. Congenital means पैदा होने से है. Congenital myopia is age of onset is present since birth. Diagnosed at 2 to 3 years of age, that is unilateral mostly. Okay, anisometropia, high degree of refractive error seen, that is 8 to 10 diopter, and it is a non-progressive. On fundus examination, myopic crescent is seen. Okay, myopic crescent, I will show you. There may be convergent squint associated with the congenital anomalies like cataract, microphthalmos, aniridia, that is absence of iris, megalocornea, increased corneal curvature, congenital suppression of the retina. Early correction prevents the amblyopia. Okay, congenital myopia, it is present, onset is from birth, diagnosed at 2 to 3 years, it is unilateral. Anisometropia seen, and it is high degree of myopia. Fundus examination shows myopic crescent, convergent squint is seen, and other congenital anomalies like cataract, microphthalmos, aniridia, megalocornea, etc. Okay, early correction prevents the amblyopia. Now coming to simple myopia or school-going myopia, it is the commonest variety. Okay, physiological error not associated any disease. Okay, it is simple one. It is seen in school-going children. Age of onset is school-going children 5 to 15 years of age. What is the etiology of simple myopia or school-going myopia? Mechanism is by normal biological variation in the development of the eye. Okay, may or may not genetically determined. Okay, you know what is the lens that can be inside nucleus, infantile, adult. There are layers are there. You already know there is some biological variation in the development of the eye. Okay, axial type of the simple myopia. Okay, physiological variations in the development of the eyeball. Okay, the size of eyeball has increased. That's why the image is found in front of the retina. Associated with previous precocious neurological growth along during childhood. Okay, sorry. Curvaceous type due to underdevelopment of the eye, and precipitating factors are role of genetics in a biological variations in the development of the eye. Okay, simple one is not so important, but pathological myopia they will ask. Okay, have a look at it. Now coming to what are children and both parents myopia. If both parents are affected, getting children is 20% chance is there. Theory of excessive near vision work in childhood, that is TV, phone and computers. Limited outdoor activity, no using of glasses properly, and poor diet causes a simple myopia or school going myopia. Okay, क्लिनिकल फीचर्स ऑफ सिंपल और स्कूल गोइंग मायोपिया सिम्टम्स आर पुअर डिस्टेंट विजन, दूर का नहीं दिखता है, दैट्स व्हाई इट इज कॉल्ड एज शॉर्ट साइटेडनेस और नियर साइटेडनेस. आस्थेनोपिक सिम्टम्स, हिस्ट्री ऑफ हाफ शटरिंग ऑफ द आईज. As the child cannot see the far things, that's why he will try to focus on the far things. Okay, that's why he will half shuttering of the eyes was present. Okay, uncorrected myopia, child becomes more introvert, studies and decreases interest in the outdoor activities. Okay, as the child can't see far things, that's why he will become introvert. Okay, signs are enlarged eyeball, anterior chamber is deep, pupil is large, sluggish reaction, fundus is normal, rarely temporal myopic crescent is seen. Magnitude of progression occurs in 5 to 15 years of age and increases till 21 years. Okay, error is usually less than -6 diopter. Exophoria may be seen, that is divergent squint. Okay, convergence, there is imbalance between convergence and accommodative effect. Okay, that's why exophoria is seen. Okay, or these are the signs of simple or school going myopia. Now coming to the what are the signs of pathological myopia, degenerative myopia or progressive myopia. Okay, this is the important one. It is a rapid degenerative progressive error of the eye, starts with 5 to 10 years of age. High myopia greater than -6 diopter can be seen in adults associated with degenerative changes in the eye. Okay, degenerative changes, some pathological disease is present. Okay, it is less common one. Etiology is role of heredity. Okay, that can be familial or race. Increase in Chinese, Japanese, Jews and Arabs, decrease in Negros and these people. Sex is more common in females than in males. Genetic is autosomal dominant, that is 18p11, don't need to remember. Sex linked recessive trait. Hereditary linked growth of a retina, growth distance of the retina. Okay, etiology, it can be familial, race, sex, genetic, sex linked or hereditary linked. Okay, hereditary linked, you can see growth or distant of the retina. In sclera is distensible, follows the retina. Okay, sclera and retina are distensible, but choroid is not distensible. You can see here, choroid is not distensible, sclera and retina are distensible. Okay, on stretching undergoes degeneration, causing retinal degeneration. Okay, see, sclera and retina can expand but not the choroid. Okay, that's why myopic crescent is seen. Okay, I will explain you. General growth process role, during active growth, lengthening of the posterior segment of the globe occurs. Okay, affected by nutrition and endocrine diseases. eyeball size increase होना है भाई, बस इतना याद रखो. Now try to understand it. Okay, genetic factors that plays a major role. General growth process plays the minor role. Okay, genetic factor is the major one and general growth process is the minor one. Genetic factor causes more growth of the retina and general growth, and both of them causes stretching of the sclera. Okay, which causes increase in the axial length, degeneration of the choroid, degeneration of retina, degeneration of vitreous. Okay, vitreous, this causes features of pathological myopia. Let me show you the picture. Okay, here you can see genetic factor play a major role, general growth process play the minor role. Okay, both of them causes stretching of the retina and sclera, which causes increase in axial length, degeneration of choroid, retina and vitreous. Okay, this is the features of pathological myopia. Because of sclera and retina are distensible, that's why choroid is not distensible. You will say myopic crescent. Okay, myopic crescent look like this. Okay, I will come there. Now coming to the clinical features of symptoms of pathological myopia. Okay, diminution of vision, that is loss of far vision. ऑलरेडी दूर का नहीं दिखता है उसको. फ्लोटर्स आर सीन, दैट इज फ्लोटिंग ब्लैक ओपेसिटीज इन फ्रंट ऑफ द आई ड्यू टू डीजनरेटेड लिक्विफाइड विट्रियस. मुस्के वॉलेंटेस. ओके, मुस्का डोमेस्टिका, यू रिमेंबर हाउस फ्लाइज, that type only. Okay, floaters are seen, floating black opacities in front of the eyes due to degenerating liquefied vitreous. Okay, high myopia is a marked degenerative change, difficulty at night vision. Okay, at night vision the pupil dilates and more of the light is entering and it can't fall on the retina. That's why at night it is very much difficult. Photophobia due to large pupil and more light enters the eye. Okay, pupils dilate होते हैं. Flashes of light may be seen. Now what are the symptoms? Diminution of vision है, floaters है, high myopia, photophobia, flashes of light. Now what are the signs of pathological myopia? Prominent eyeball elongated one, affects the posterior polar and surrounding area. Eye parts are anterior to the equator or normal. Axial length is greater than 26 mm. Okay, size of eyeball is increased. That's why axial length is increased. Cornea is large and entry chamber is deep. Pupil is large, sluggish reaction to the light. Magnitude of refractive error is -10 to -40 diopter. Fundus examination shows optic disc, that is myopic crescent is seen. Okay, choroid is a beta zone, sclera is a alpha zone. Okay. I will show you what is myopic crescent. Nasal side it is superior traction crescent, positive. Okay, retina is pulled over the disc margin, tilted optic disc. Okay, this is a myopic crescent. Okay, let me explain. Here you can see retina is there. Here below will be sclera is there. Sclera, choroid, retina. These three layers. Retina and sclera are distensible. They expand, but the choroid remains at the same place. Okay, these both expand. That's why this type of crescent is seen. Okay, crescent, moon shape. Okay, temporal myopic crescent, temporal myopic crescent, temporal myopic crescent. Try to remember it. Okay. Nasal side traction, that is temporal myopic crescent is seen. Degenerative changes of retina and choroid are seen, that is cystoid degeneration at the periphery, lattice degeneration, chorioretinal atrophic patches at the macula with heaping up with pigment around them, total retinal atrophy. Okay, what are the degenerative changes seen in a myopia? Choroidal cystoid degeneration, lattice degeneration, chorioretinal atrophy with heaping of the pigment around them, and total retinal atrophy. Okay, read 2 to 3 times. Cystoid degeneration, lattice degeneration, chorioretinal atrophy, total retinal atrophy. Okay, here you can see fundus changes of pathological myopia. This is myopic crescent. This is a you can see temporal myopic crescent also. Fundus changes pathological myopia. Now coming to what are the other signs. Okay, you can see Foster-Fuchs spots. What are Foster-Fuchs spots which are seen in pathological myopia? Dark red circular patch at macula due to subretinal neovascularization and choroidal hemorrhage. Okay, try to buy it only. It is a important one. Foster-Fuchs spots are seen in pathological myopia. Dark red circular patch at macula due to subretinal neovascularization and choroidal hemorrhage. Okay, एक सर्कुलर पैच दिख रहा है मैकुला पे बिकॉज देर इज न्यूवास्कुलराइजेशन एंड ह्यूमरेज. ओके, tessellated or triggered appearance of the fundus due to diffuse attenuation of retinal pigment. Okay, here you can see normal fundus, then black dark lines, normal fundus and dark lines. Okay, you can see lacuous cracks, that is fine breaks in the Brooks membrane, that is inner layer of the choroid. Okay, this is from marrow point. Okay, marrow app ka rhegmatogenous retinal detachment is seen. Others are posterior staphyloma. Now you already know staphyloma means like कुछ bulge होके बाहर आ रहा है. Posterior staphyloma is seen. Okay, degenerative changes in the vitreous, that is liquefaction, opacities are seen. I already said floaters, right? Posterior vitreous detachment, PVD, that is vis reflex, and vitreous hemorrhage. Okay, degenerative changes in vitreous are liquefaction, opacities are seen, posterior vitreous detachment, that is vis reflex, vitreous hemorrhage. Visual field is ring shaped scotoma is seen. Okay, रिंग शेप स्कोटोमा सेंट्रल, सिर्फ सेंट्रल का दिखता है. एल्ट्रोरेटिनोग्राफी शो सब नॉर्मल ड्यू टू कोरियोरेटिनल अट्रोफी. ओके, देर आर डीजेनरेटिव चेंजेस दैट बिकॉज ऑफ डीजेनरेटिव चेंजेस देर इज कोरियोरेटिनल अट्रोफी. ओके, कॉम्प्लिकेशंस ऑफ पैथोलॉजिकल myopia are complicated cataract, vitreous hemorrhage, retinal detachment, choroidal hemorrhage, convergent squint or strabismus, primary open angle glaucoma. Okay, these are the complications are also there in signs and symptoms. Few of these. Okay, vitreous hemorrhage है और retinal detachment है, that is PVD I already told. Choroidal hemorrhage hai, same thing. Okay, these are the complications. Now coming to the last one, that is secondary myopia. Now we have finished the three things. After that we are going to fourth one, that is secondary myopia. Etiology, that is curvatural one, that is corneal curvature or lenticular lens curvature में problem है. ठीक है, index myopia में nuclear sclerosis that causes a secondary sight, incipient cataract, and myopia in diabetes, that is increase in the glucose in the aqueous and the lens, decreases refractive index of the cortex. Okay, that is SM is curvature secondary myopia. Positional secondary myopia, that is anterior subluxation of the lens. Conjugative myopia, that is surgical overcorrection of the hypermetropia or pseudophakia with overcorrected intraocular power of the lens. Okay, लेंस ऐसा यूज कर जाता है जिससे मायोपिया हो जाता है. ठीक है, सूडो मायोपिया मीन्स आर्टिफिशियल मायोपिया, अकोमोडेटिव मायोपिया ड्यू टू स्पैजम ऑफ अकोमोडेशन, दैट इज मायोपिया ऑफ प्री मैच्योरिटी, MOP. ड्रग इंड्यूस मायोपिया, दैट इज कोलिनर्जिक ड्रग्स और स्टेरॉइड्स और सल्फोनामाइड्स. ट्रीटमेंट ऑफ द अंडरलाइंग कॉजेस, ट्रीटमेंट ऑफ द सेकेंडरी मायोपिया. ओके, सेकेंडरी मायोपिया मीन्स कोई अलग चीज़ की वजह से उनको मायोपिया हो रहा है, दैट इज कर्वेचरल और इंडेक्स और पोजीशन ऑफ द लेंस और कॉन्जिगेटिव और यूज ऑफ ड्रग्स और फ्रॉम प्री मैच्योरिटी और सूडो मायोपिया. ओके, लेंस की वजह से. नाउ कमिंग टू द ट्रीटमेंट ऑफ मायोपिया. we will give optical treatment. Most commonly we will use concave lens, okay, which concave lens causes images to form on the retina, okay, जो सामने की तरफ इमेज फॉर्म हो रहा था उसको पीछे की तरफ खिसक लेता है, ठीक है. बेसिक रूल इज मिनिमम एक्सेप्टेंस प्रोवाइड मैक्सिमम विजन शुड बी प्रिस्क्राइब्ड, ओके. मिनिमम एक्सेप्टेंस with maximum vision, okay. Models are spectacles or contact lens can be given. Contact lens for high myopia because they avoid peripheral distortion and manifestation, okay. Second surgical treatment is corneal based approach, that is radial keratotomy, that is RK, and laser ablation keratotomy, that is by photorefractive keratotomy, that is PRK, or laser assisted in situ keratomy LASIK, okay. Radial keratotomy or laser ablation keratotomy. In that there are two types, PRK and LASIK. Refractive lenticular extraction, that is relax, or small incision lenticular extraction. We can also use intracorneal ring implantation or orthokeratology, that is lens based procedures. Fukulas operation, that is phakic refractive lens can be used, and low vision aids in progressive myopia can be used. What are the preventative measures of myopia are therapeutic to prevent the progression. Atropine eye drops can be used, that is 0.01% at night, because there is डायलेशन है, प्यूपिल डायलेट हो चुका है, इसलिए रात की वजह से उनको कम दिख रहा है, ठीक है. अगर हम अट्रोपिन यूज़ करेंगे तो थोड़ा मायोसिस हो जाएगा और विजन इंप्रूव हो जाएगा, ठीक है. और बट वी विल यूज स्मॉल अमाउंट, ओके. जनरल मेजर्स आर मेंटेन विजुअल हाइजीन टू अवॉइड अस्टिनोपिक सिम्टम्स. Proper posture of the good light important for near work. Avoid excessive use of near work. Increase outdoor activity. Balanced diet rich in vitamins and proteins. Early management of the disease, okay. Genetic counseling. Avoid marriages between two progressive myopic persons, okay. अगर दो लोगों को मायोपिया है तो उन दोनों के बीच में शादी करना थोड़ा अवॉइड करो, ठीक है. इसलिए आप लड़की पटाने टाइम अगर आपको चश्मा है तो जिसको चश्मा नहीं है उसको पटाओ, ठीक है. मायोपिया, दिस इज द ट्रीटमेंट ऑन, ओके. लेंस दे सकते हो, अगर और लेंस भी दे सकते हो या फिर सर्जिकली ट्रीट कर सकते हो, ओके. सर्जरीज में ये सब है. हैव अ लुक. यू कैन टेक स्क्रीनशॉट ऑल्सो, ओके. सेकेंडरी मायोपिया, फर्स्ट फुक स्पॉट्स, दिस आर साइंस एंड सिम्टम्स, okay. That's it. This was myopia, okay. Myopia, there are 4 types: pathological myopia, secondary myopia, congenital myopia, or simple or school going myopia, okay. With this I will end this myopia here. See you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.